Motor milestones. What are they? And why are they so important? I'm Dr. Monika Buerger, and I'm going to drop some pearls that you may not have even thought of putting together. So, first of all, motor milestones, fine gross motor acquisition, is especially important to have a keen eye on in the first 2 years postnatally. So first of all, you need to understand what those milestones are, what they look like, how they should be properly progressing through these milestones, and at what ages. But what might slow these down? What might they indicate if you're not seeing those happen? First of all, fine and gross motor skills are considered one of the number one predictors of interest for a child later on being diagnosed with autism or other neurodevelopmental consequences. So we need to make sure we get the story straight from the beginning. We need to be able to see what those milestones are looking like, understand what they mean, what they're telling us, but also why might they be delayed? One thing you may not put into this whole contextual picture is acetaminophen. Yes, acetaminophen is in Tylenol. It is in paracetamol, and it's also in a lot of other over-the-counter cold aids and sleep aids, etc. So it's mostly known for it to be in Tylenol. There's been a number of studies over the years that link acetaminophen use in the prenatal period, so maternal acetaminophen use, to developmental delays in offspring, particularly autism and ADHD, asthma, and other neurodevelopmental consequences or neurodevelopmental delays. And just recently, another beautiful paper dropped. Again, it was more of a systematic review that looked at studies over the years, and what they found was the higher quality studies showed a link with maternal use of acetaminophen and ADHD, autism, neurodevelopmental delays. Now, the other thing we need to consider is it's often used during pregnancy for pain relief. About 50-ish% of women tend to have lower back pain during their pregnancy, rightfully, right? You've got ligamentous instability, biomechanical changes, and all the things that we understand that lead to lower back pain. About 76% of pregnant women in the United States report using some over-the-counter pain relievers, and about 71% of those women report using acetaminophen. We need to put this into a whole overview standpoint. What acetaminophen does is it is known to wipe out the master antioxidant in the body, known as glutathione. So basically, it is what we need to zap out free radicals, to keep neural inflammation in check, and to ward off pathogens and other things that can affect the neurodevelopmental status of that developing fetus. And so therefore, if we don't have enough glutathione, there's been also studies that link children on the autism spectrum with lower levels of glutathione. So now we can have a shift, a pro-inflammatory shift with infectious loads getting out of control, etc. Another common factor that we see that kiddos struggle with neurodevelopmental delays, especially autism. So what do we need to do? First of all, we need to be able to educate parents and parents-to-be on alternatives to using pain relievers. Chiropractic obviously would be number one on our docket, is to explain to moms that there is an alternative to pain relief, getting them through pregnancy. Number two, why we don't want to look at using things with acetaminophen. The other thing we need to educate parents and parents-to-be on is after that little fit of fart comes to the world, when they might have procedures like circumcisions. There's data that looks at boys that have undergone circumcision and using Tylenol for pain relief or fever relief. By the way, acetaminophen is not really shown to have great anti-inflammatory or fever effects. So, just saying. But it's often recommended and used for those situations. But there are links to boys undergoing circumcisions using Tylenol and later on being diagnosed on the autism spectrum. There are also studies that link vaccines used or Tylenol used in tandem with vaccines to help mitigate fevers, soreness, etc. also has led to a higher risk of later on being diagnosed with autism. So we need to understand the literature and understand how to present this to our parents or our parents-to-be about why we can look for alternative methods in lieu of using over-the-counter pain aids and fever aids such as Tylenol or things that contain acetaminophen in them. Then it also, I always say rewind and fast forward. If you have a little fiddle fart that comes into you that aren't reaching their motor milestones, again, there is a link between maternal use of acetaminophen and a lower acquisition of fine and gross motor skills. Something we need to be savvy on to be able to look at, are these kiddos meeting these milestones? If you're not seeing that, that is a great history question to ask the parents. Was there any chances there was any use either in fetal development or in the early ages of Tylenol use? And then you want to go backtrack and say, okay, might we be depleted on this master antioxidant called glutathione? Might this child have a chronic inflammatory load that is disrupting neurodevelopment, and that is why they can't reach these motor milestones? Then we can start to help support their system from a chiropractic standpoint and from a neuronutritional standpoint. Most certainly, you want to look at helping support the microbiome, and because that's a brain-gut connection, and help this child now to reverse or mitigate, stop their compromised neurological integrity so that they can move forward in these motor milestone patterns. And motor milestones, building a brain is what you're doing. Movement patterns are brain patterns. Movement of the body builds a brain. Just wanted to put all those pieces together for you. If you have a child that's you're seeing some delayed characteristics, take a good history, go back, fill in the potholes, join. If you want more of this information, you really want to understand how to put these pieces together, how to dive in, how to support the mind and the microbiome. Scroll down right now, dive in, dig in, join our Foundations of Neurodevelopmental Practices. It's an amazing program. We'll teach you all the nuts and bolts, how to take a keen eye to these developmental milestones, how to do a great history, how to support the microbiome, and how to help turn the tide for healthy generations to come. I'll see you on the inside, and let's help America get healthy again.